Hello everyone, this is Ethics in Healthcare PowerPoint presentation. Ethics is defined as a moral principles that govern a person's behavior. It's also a branch of knowledge that deals with moral principles. We know that ethical issues or dilemmas arise in all types of organizations, particularly in health service organizations. Ethical dilemmas happens all the time. When we think about health services, we're thinking about mental health as well as physical health. This can be a mental health facility, an outpatient mental health therapist, or medical providers. Ethical issues can happen in all types of service organizations, but we pay particular attention to ethical dilemmas and want to make sure social workers are aware of the ethical issues that arise in their practice. With the progression of technology, even more complex situations have been created that require decision making. When we think about ethics, ethics requires judgment and clear rules. And sometimes these clear rules are not always available in healthcare. That's why we talk about ethical decision making and understanding the steps to ethical decision making, because the rules are not always set and clear. It's not black or white. And so oftentimes we have to come up with a decision that benefits most. And we come up with that decision by applying important ethical um, principles. There are some organizations, particularly those who are accredited institutions, that have mechanisms or methods in place in order to resolve ethical issues. Oftentimes, in healthcare, Joint Commission is a regulatory body that accredits hospitals, and they require that institutions that have Joint Commission accreditation have these mechanisms in place to deal with ethical dilemmas. So, what are some of the ethical principles that we're going to go over a little bit here? Respect for others, beneficence, and non maleficence, as well as justice. Respect for others includes autonomy, allowing people to govern themselves without external coercion, and it's a form of patient empowerment. An example of autonomy is, for instance, having a patient that you're working with and wanting them to receive some additional support services on top of the work that you're doing with them, and giving them the option of perhaps seeking peer support services or more specialized support services for, let's say, substance abuse. And so you tell a client that, that you feel though they need additional support services on top of what you're providing them, and you would like to make a referral. You offer peer support groups such as NA, Narcotics Anonymous, that could be helpful for them. And or you tell them that, or they can maybe go and see a substance abuse counselor, and you give them an option of which one they would want to choose for their supplemental support. Or perhaps giving them a list of providers, and allowing them to pick the one that serves their needs. They may pick a provider because it's more closer proximity to their home. They may pick a provider because they speak a primary language that the client also speaks, such as Spanish or French. Either way, you're empowering that patient to choose what's in their best interest or what they prefer in terms of their treatment. And so autonomy, that would be an example of that. Truth telling also involves respect for others. Truth telling is honesty by caregivers, but balanced with non maleficence, meaning doing no harm. So, honesty by caregivers include being open about our scope of practice, limits to services. Truth telling also is the expectation or the obligation that clients have for us to be open and honest with them about a host of things in the professional relationship. And so being honest about truth. If there was a mistake made by the provider or the institution, truth telling applies to that as well. And again, the importance is that we're sharing information and being open and honest with clients. Confidentiality is also a form of another area that we look at under the principle of respect for others. And confidentiality means that we offer privacy and confidentiality to clients as it relates to their health care, their protected health information, privacy about things that they may disclose to us. But we still have to be mindful with confidentiality. There's limitations to confidentiality. And there are things where we cannot be confidential about it. And that's where truth telling may also apply too. And that being honest with clients about the content that they share with us that's confidential and content that may not be confidential, such as letting them know that if they disclose that they're going to hurt themselves or somebody else, we can't keep that confidential. So the truth telling would apply to confidentiality in that respect. Also, limitations to confidentiality has to do with child abuse and elder abuse in situations where clients may disclose elder abuse, child abuse. We can't keep that confidential. And so, again, truth telling as it relates to our limits to confidentiality is important, and maintaining confidentiality as much as possible. And fidelity is performing one's duties, keeping one's work, and keeping promises. And that shows us respect for clients, making sure that we're practicing at the top of our license, that we're doing our due diligence in our service and high quality services, such as documenting on time, making sure we're keep ourselves abreast of current literature in terms of treatment options, evidence-based practices, and that all speaks to fidelity. So again, when we think about respect for others, these are examples of how we apply that in decision making. So these are broad terms, broad concepts, but you apply these principles and these specific areas within these principles in our decision making when it comes to ethical decisions and or dilemmas. Beneficence. Hospitals and caregivers have a moral obligation to benefit others. That means the care and the service that we provide should benefit the client. If we're doing anything that doesn't solely benefit the client, it could be an ethical issue. We do all that's in our power to heal suffering caused by illness and injury. This can be mental health or physical health injury, illness and injury. Okay. And all our efforts should be showing that it should benefit the client. And this includes offering charity care to the financially needy. That means that we should not, it's an ethical expectation that we do not limit services to people just because of finances or inability to pay. Again, so when you think about this principle, you want to make sure that when you're coming up with ethical decisions, that you're making sure that you apply this standard, this principle of when I've come up with this decision, am I making sure that this decision benefits the client or the patient, and that the decision that I'm coming up with, does it serve to heal suffering, illness, and injury? And does it also include supporting clients wherever needed? And this is an example of a financial support. So again, this is a principle that we apply. Non-maleficence. Medical professionals have a moral obligation to not do any harm, to do no harm. And this requires benefits of treatment or course of action must outweigh harm. So when you're coming up with a decision to an ethical dilemma, the other standard that you want to apply here is, does this promote not doing harm? This decision that we've come up with. And also, we have to think about a lot of what we do has that may be good and bad, maybe both good for clients and harmful. An example of that is medication. As many of you know, oftentimes you can prescribe medication to clients and they have a host of side effects, such as severe headache, gastrointestinal problems. You've seen commercials for different pharmaceuticals where they talk about heart attack, stroke, blood clots. Actually, life-threatening side effects can occur with some of these medications. But here, what we try to apply is, does the benefit of the medication outweigh the harms or the risks? So here with non-maleficence, you want to make sure that any course of action decision that you're making, particularly related to an ethical dilemma, if the benefits of the decision that you come up with outweighs the harm. Justice encompasses fairness and equality, and it denounces discrimination in the delivery of healthcare. Here, I want you to think about Howard University's Black perspective. And a lot of our guiding philosophy, the goal is to provide a quality of service and a frame of reference or a lens or perspective in which we are trying to improve the experiences of people of color and those who are marginalized and oppressed. And so you have a sense of justice here. So with this principle, you want to make sure that the decision that you're making includes fairness and equality. Has that been considered in your due diligence of the decision? And are we making sure that when you come up with that ethical decision, that it also it has these elements of fairness and equality to it? And this is important, particularly in healthcare, where we have a lot of health disparities related to physical and mental health. Ethics in the law. Ethics is distinguished from lawfulness. The law represents only minimum standards of morality, whereas ethics goes a lot deeper in terms of moral standards. Please be mindful, though, a social worker can be behaving legally and ethically and unethically and illegally, right? Those are pretty easy concepts to grasp, right? But we distinguish ethics from law because there are behaviors that a social worker can make where they are behaving ethically but illegally. Think about Narcan and administering Narcan to a client who's overdosing, which would be considered ethically appropriate. However, the prescription for Narcan oftentimes is not in your name, right? It may be it has to be prescribed by providers, and some states may regulate what providers can administer Narcan or not. So you may be trained in how to deliver it. You may work with a high risk population for overdose and be prepared to save somebody's life with this Narcan. But in the state that you practice in, you may not be a authorized provider to administer it. So in that aspect, from a social work perspective, you can be ethically behaving appropriately by saving a client's life. Think about respect of the client. Think about do no harm. Think about benefit of non-maleficence. Think about beneficence, benefiting others, right? Those apply here. Ethically, you did the right thing, but from a statute, you might be doing the wrong thing. Legally, it might be illegal. Let me say it that way. A social worker can behave non-ethically and legally. An example of that would be in engaging in a consensual relationship with a client. Again, a consensual relationship with a client. An adult client, adult therapist decide to embark on a relationship together. Legally, under the eyes of the law, there is no laws broken. There's no state laws that have been broken, but it's ethically inappropriate to engage in relationships with our clients, according to our code of ethics and many professional ethical standards. So those are examples of how we distinguish decisions and behaviors that can be legal versus ethical. There are also tools to support ethical and legal behavior. They include the Patient Bill of Rights, informed consent, and patient-centered care. Patient Bill of Rights reflects ethically and lawfully care in areas such as confidentiality, consent, patient decision making. Again, ethically and lawfully, the Patient Bill of Rights really highlights areas such as confidentiality, consent, and patient decision making. Informed consent refers to the patient's right to make informed choices regarding medical treatment and draws from the ethical principle of autonomy. Informed consent oftentimes are tools that are considered ethical and legal. And it can be legal as well. Patient-centered care, ethical care integrated into organizational culture involving patients in their own care, creating a caregiving environment. And so when you think about some of the tools that you use in healthcare in general, Understand how these tools have both ethical and legal implication to our work. Other Another type of tool is advanced directives, and we have three types: do not resuscitate, living wills, and durable power was a power of attorney. Do not resuscitate orders are orders to not administer any artificial means to sustain life when the heart stops or if someone stops breathing. This could be an ethical dilemma, given given a specific type of situation. However, having a do not resuscitate order is important because this is the client actually putting this order in place for themselves, agreeing that they do not want life sustaining or life saving or heroic measures taken under a given circumstance. You'll see this often if you're dealing with clients who have terminal illnesses and where they may be admitted to the hospital, and knowing saving their life is not going to improve the overall outcome, which may be terminal for them anyway. So they don't want heroics taken when they know they're in the stages, already in the stages of dying. That's an example of that. But having these orders in place allows the doctors to make decisions based on their understanding of what the patient already wants. Living will communicates a person's wishes regarding medical treatment when he or she becomes incapacitated. However, the problem with a lot of living wills is that they're written very generally and does not cover all situations that may come up in a hospital or healthcare course of treatment. And so again, living wills are ways that we respect the client. Think about the ethical principle of respect for others, respecting what they want with this living will. It also speaks to benefiting clients by making sure, and autonomy specifically. Durable power of attorney, written legal document that appoints another individual to act as the patient's agent for the purpose of healthcare decision making when patient is unable or unwilling to make decisions. This can happen in medical and mental health often. In medical circumstances, somebody may be in a coma, for an example, unable to talk, communicate. And in that aspect, the durable power of attorney will kick in where someone else can and serve as what we call a healthcare proxy or make decisions on behalf of that particular patient. And these are good because these are something that the patient puts in place prior to any adverse event. You'll see it oftentimes in mental health because sometimes people are experiences episodes, particularly a psychotic episode, for example, where they may not be able to mentally function. They're so mentally impaired that they cannot make decisions on their own. And in that aspect, the durable power of attorney would kick in where a family member, a spouse or a parent can make decisions on behalf of somebody. You also see this kick in if somebody is considered or admitted to an inpatient psychiatric facility. And in those while they're there, they may be deemed incapacitated. They're not functioning at a high enough level to be able to take care of themselves or make decisions. There are other types of mechanisms for ethical decision making as well, and one is the ethics committee. These are oftentimes multidisciplinary teams that can be made up of clergy, pastoral care, or chaplains, social workers, physicians, nurses, and administrators. They're oftentimes found in healthcare organizations, and they're brought in. They have special training in ethical matters, and they're brought in to help a medical team, come up with an ethically appropriate decision. And they listen to the information and all the ethical dilemma and the challenges, or any conflicts that may arise. We talked earlier about legal being different from ethical. There may be policies that are in place that are ethical but not legal, or legal or not ethical. And then that's where the conflict can potentially arise. And so what happens is through the ethics committee, they understand where the dilemma is, where the conflicts are, whether it's the medical team wants one course of action and the patient wants another one. So they really understand the factors, and then they apply different type of ethical theories and decision making models to help that team process all options and come up with the one that's most ethically appropriate. They're developed to establish guidelines and standards for ethical decision making in the healthcare delivery system, and more importantly, they resolve issues related to medical ethics or healthcare ethics. Care providers have a moral responsibilities to behave ethically, and administrators and managers must also act as moral agents, balancing fiduciary responsibility to act prudently in managing organizations. However, their responsibilities to patients must take precedence. Um, we all have, as care providers, have a moral responsibility to behave and act ethically at all times. However, when people have administrative positions such as directors, managers, and supervisors, they are charged with having the best interests of the agency in those leadership roles. But here, ethically speaking, we need to make sure that even when you're serving in a role as a director or a manager or supervisor, that precedence or priority is given to the patient, even when you're serving as a leader or leadership for an organization. And that is what that last bullet point is saying. When there's conflict between agency and interest and client interest, we must prioritize the clients in ethical decision making. But just please understand that conflict can be with agency or agency policy and the client. There can also be dilemmas between the law and client. It can be there can be many violations, and we need to be very clear where the dilemma falls. Is it a conflict between, if we follow agency policy, we're violating a duty to the client or respect for the client if we're following agency policy? If by meeting the needs and benefiting the client beneficence, are we violating policies of the agency and or any legal statutes as well? So again, understanding where the conflict is the key to understanding whether you're dealing with a dilemma, an ethical dilemma. When we're thinking about informed decision making, we have plenty of considerations. It's your personal values. You have to know and understand what your personal values, how that would inform your decision making, your discipline, your professional values, and how that informs your decision, institutional values, the value of the institution, as well as society value at large. All these values come into play when you're thinking about ethical decision making. You're also, again, applying ethical theory such as Kantian or utilitarianism. These are models, ethical theory models. Which one are you applying? Different ethics committee may ascribe to different ethical theory models in as their decision making models. You also want to consider your code of ethics and other professional standards in which you follow when you're thinking about ethical decision making, and applying all these different frameworks to making sure that you're coming up with the best decision for clients. You also want to consult with relevant agency policy, and again, be aware of the federal and state laws as well as your professional boards and other regulatory bodies. And also you want to make sure you are very clear on whatever decision or the different decisions options that you have. You want to be very clear how that impacts patients. Each decision you may come up with, you have three options in terms of decision. You want to pick the one, or you want to be at least clear how each of those decisions options impact client and families, and then pick the one that serves the interests of all the best. And you also want to be mindful of how it may impact the agency and other practitioners. And so also the idea of whistleblowing is something to consider as well. Sometimes doing the ethical appropriate thing and sometimes even the legally appropriate thing maybe to be a whistleblower, especially when there's wrongdoing and harm happening, particularly if it affects or adversely affects patients and clients that you're working with. There are plenty of specific decision-making steps that you can use to apply ethical considerations and principles to come up with the final decision. This is just a broad understanding of decision-making steps. There are, again, plenty out there that are more specific, but most of them, if you follow along or you research some of them or read about them in your textbook, they tend to still highlight these main areas in decision making. One is recognizing that there is a problem, and more specifically, an ethical dilemma. Where does that conflict falls between um, agency, patient, or law, ethic, our code of ethics? Where is the violation coming through? Where's the conflict? Investigate the variables. Think about all the violations, the concerns, the challenges that may present, as well as um, investigate the options for decision making. Which principles are on the table are you considering? What are some of the violations to those ethical concerns? And be clear what they are. Don't go about it alone. Obtain feedback from others. That's why a lot of healthcare organizations have ethics committees. That's their consulting and getting feedback from others who are trained in ethics to help make that call. Usually think about your team. Ethical decision making cannot occur in a vacuum, and it cannot occur with one person. You need to hear what other values are at play, what other professional values are at play. You also want to, again, appraise applicable values in relation to dilemma. Think about, again, your personal values, your professional values, agency values, societal values, and how they come to bear on that decision. And make sure you consider alternatives. Make sure that you're very clear on what all the options that are available to you, what all decisions options there are, and making sure you're picking the one. And not only just understanding what the different types of decisions you can make in a given matter, but also understanding how each decision that you can come up with impacts patient, families, colleagues, agency, etc. And part of that is weighing the pros and the cons. Pros and cons for patients, pros and cons for agencies, colleagues, the profession, and so forth. And then you finally make your decision. But that is ethical decision making, when you go through all those steps, when you vet your decisions thoroughly to make sure that you're coming out with the best option available. Some people, when they're applying ethical standards, they think about rank order principles, and this is just prioritizing the principles and which principles are most important given a particular ethical dilemma. It exists with basic needs, so you want to think about basic needs and how they're being met if it applies. You want to think about the principles of justice, so fair and equality, and where does that rank in an ethical decision that you're making? Free choice, freedom. This is autonomy and free from external coercion, for example. Cultivate a good quality of life, benefiting clients, beneficence, um, secure privacy and confidentiality. Okay, respecting the client, that's what that falls under. Privacy and confidentiality. Understanding the truth, respect of client, truth telling, and receive available information, again, respecting the client. Again, this PowerPoint just briefly talks about ethical decision making, highlighting some specific ethical decision making principles that you will find in healthcare. Please be sure to read your textbook thoroughly and in more detail, as these PowerPoint presentations are meant to just cover the key areas of considerations and to enhance your learning of the readings that you have completed thus far. Thank you.